lost over 350,000 Americans to both prescription and illicit opioids since 1999. And the epidemic has, as you said, has sort of taken three waves. The first wave was prescription opioids. We've lost 200,000 Americans between, in that time period. They increased markedly up to about 2011, then plateaued a little bit, and then have spiked again over 10.5% just between 2015 and 16. The second wave was heroin, beginning around 2010. We're now losing over 15,000 Americans a year to heroin-related deaths. And finally, and perhaps most insidiously, is fentanyl-related deaths, or illicitly manufactured fentanyl or fentanyl analogs like carfentanil. We've seen a 6.5-fold increase in those deaths just since 2013, and we're now losing almost 20,000 Americans. Last year's data, when we looked at it in more detail, a 52% increase in cocaine-related deaths and a 33% increase in other psychostimulant deaths, such as methamphetamines. And we think other research indicates that that may be associated with the contamination of those other drug supplies. I mean, I think it's still an open research question, but because they've increased dramatically, we do have some concern. It's continuing to worsen, and that's so troubling to us. And we are making some progress on prescription opioids, although they are higher than they have ever been. Opioid prescribing is beginning to decrease, so we're buoyed by that. But the illicitly manufactured fentanyl is just really difficult, and it's causing so many deaths because of its potency.
And carfentanil, that's even more potent, right? And
yeah.
Where exactly did it come from?
Yeah, carfentanil is 10,000 times more potent than morphine. It's used to treat large game animals like elephants that weigh between 3 and 7 tons. And in some analysis that CDC did last year, over 17% of deaths in Ohio, 350-something deaths, were associated with carfentanil. And preliminary data that we have for 17 indicates that that number may have doubled. And we're seeing an increasingly large number of states that are reporting carfentanil on board drug overdose deaths. Yeah, we think it's because there's variation in how opioids are prescribed. So that's one of the reasons the CDC came out with the opioid prescribing guidelines in March of 2016 that focused for primary care clinicians treating chronic pain outside of active cancer, end of life, and palliative care, is to put out some specific recommendations that are starting points, if you will, for clinicians to have conversations with their patients to determine if opioids are right and if the benefits outweigh the risks, and to come up with a protocol to make sure that they're appropriately monitored over time to make sure that patient safety isn't compromised. Yeah, so we've seen a decrease in prescribing overall beginning in 2010, and later this year CDC is going to be part of a group that's releasing information on what is the additive impact of the release of the prescribing guidelines. So we're excited to be publishing that. That work is in clearance right now.